Welcome to InSight Radio, powered by Vision Science Academy.
From London with Sucheta Mitra.
Ladies and gentlemen, welcome back to another episode of InSight Radio, where we envision future of vision science one voice at a time. I'm your host, Sucheta Mitra, Education Engagement Manager at VSA and Doctoral Researcher at Cardiff Metropolitan University. Today we have an esteemed honorable guest, Dr. Veshal Madan. He is a director and professor at D.Y. Patel Institute of Optometry and Vision Science. And he is a highly accomplished professional with an impressive background in optometry and vision sciences. His educational journey is truly remarkable, including a bachelor degree in optometry from Shankara Nethralaya, a master degree from Bharati Vidyapit. He is also pursued postgraduate diploma in personal management and holds a MBA as well. He also holds a Doctor of Philosophy in Optometry from D.Y. Patel Medical College. Throughout his career, he has been actively involved in teaching, research, and clinical practice, shaping the future of optometry in India and beyond. Dr. Madan's expertise extend to various areas including contact lens education, pediatric optometry, retinal diagnostic, and so on. We are honored to have Dr. Madan with us today. Get ready to embark on a fascinating journey of discovery and learn from one of the industry's finest minds. Without further ado, let's dive into the enlightening conversation with Dr. Veshal Madan on InSight Radio. Welcome, Dr. Madan.
Thank you for such an enlightening introduction. Thank you for having me.
Thank you, Dr. Madan, for accepting our invitation as well.
My pleasure.
Dr. Madan, you have a very impressive and inspiring career journey. Looking back at your decades of experience as an optometrist, how do you believe your decision to pursue a career in optometry has shaped your professional journey?
That's a good question. So, my journey started with an inspiration from my father, who was an ophthalmic surgeon, and he was in army also. And going around with him and seeing a lot of cases when he was in army, I had a good exposure of patients and eye-related diseases and conditions. So I wanted to be something like my father. Tried my best to get into Armed Forces Medical College, but first time couldn't get through. So another alternative was to get into optometry, and that time Shankara Nethralaya Allied School of Optometry Chennai started in 1985, and I went there in 1992. So I got through the first selection and got into optometry, which was quite similar to what I dreamt of getting. And that is the reason, the decision which and the vision which I had envisaged had come to. So it has helped me to become a better professional. I think that is what you are asking.
Yes, definitely. Our journey started from your home only.
Yeah.
That's truly inspiring.
Yeah.
So, Dr. Madan, you also founded the optometry school at D.Y. Patel Medical College. What inspired you to establish this institution and contribute in the field of optometry?
Yeah. So my journey started in Allied, and I could see the quality and the dedication in people there. And in general, this profession as optometry and healthcare professionals demand. So I could see that there is always a chance of improvement, and I wanted to bring that culture, that zeal, that enthusiasm in here from where I was settled with my father in a clinic here in Pune, India. So I wanted to deliver that, and then in 1998 when we had our Indian Optometric Association conference here, which was a national conference of optometry. At that time, Dr. Patangrao Kadam from Bharati Vidyapit founder, we had called him as a chief guest with Amod Gupte sir here as a founder. And we persuaded him to start an optometry. He was a little flabbergasted and wondering why what is optometry? Never heard. Are you giving glasses to people? So I said, no, it is not. It is much more than that. And I showed him with Namud Gupte, sir, of course, a file, a movie, and photos of what we were doing in Shankar Mitra and Chennai. So that sort of thing inspired me and the team here with Namud Gupte and other people here, and the people who helped us to set up a optometry college in Bharti in 1990. Then I took some years there, 5 years I was there, and then I thought of expanding my expertise and giving my knowledge to another very upcoming institution, Dr. D.Y. Patil Institute, Medical College, and there my father was the head of the department. So I took an opportunity to use my expertise now that it was perfectly settled in Bharati Vidyapeeth, and we had a lot of people graduating by then. 5 years was a long time. I went to D.Y. Patil and started humbly small with the only 8 students in way back in 2005. And with the help of Ophthalm department and other departments, medicine and all, we were able to start that. And that was the reason why I wanted to start there, was to give quality education, what I had learned in Shankar Mitra.
Yes, that's truly commendable. And I know in India there are lack of institute like D.Y. Patel Medical College, and we truly need those institutions more and more.
Yes.
So, Dr. Madan, could you share some insights, as optometry is an emerging career in India as well?
Yeah.
So, could you share some insight into the work and efforts involving in setting up an optometry school?
Yeah, I was about to add that also. So when you said that we need a lot of good colleges and institutes, it is very easy to set up. As far as the big universities are concerned, like Bharati Vidyapeeth, D.Y. Patil, even if you go to West Bengal and Delhi, there are a lot of international private universities with NAC A++ accreditation. So under the UGC rules, anybody who has attained more than 3.5 of grading out of the 4, that is the unit scale, as a NAC score, they can always start their independent institutes with the specialized courses like optometry, audiology, and so on and so forth. They just need to inform UGC about it, and then you can definitely start it. So coming to the point, what you had asked me, it's not difficult at all for you, me, or anybody to start. If you have the enthusiasm and zeal, you need to make a proposal. And I'm there, Amut sir is there, because I've been founder member of more than 2 colleges. First Bharati in 1998 and 2005. D.Y. Patil were doing extremely well, both of them, right now. And these things have helped me to set up a good proposal with the experience. So you can always approach us and we can help you to set up. And these institutions, whether they are in India, in whichever part of India, this will be a good milestone for optometry. Coming to the reason why I'm highlighting this is that the initial fear is always there in people, so don't worry about it. It is very easy to set up. They are, as an institutional head or as our management team, they're interested in helping people. And eyes is one thing which I have seen is very much the treatment of the eyes, whether it's related to refraction or minimal counseling or education, is very much required for developing countries like India and Nepal. You will be surprised that I've been to Nepal 3-4 times, and what I found out when I traveled far and wide from one end of Nepal to another, just because we wanted to see the Nepal and get the feel of optometry development there, you will be surprised the maximum number of hospitals, even in small places in Nepal, was eye hospitals and optical clinics. I mean, dispensing counters. So what I took as an inspiration is that eye and eye-related problems are the most common, irrespective of caste, creed, religion, or place. So coming to your point, yes, it is very easy. Anybody can set up.
Okay, so sir, there will be some of the challenges, whether we talk about taking some kind of licenses or certifications, or gathering the students first of all to start an institution. How can somebody overcome it?
So first thing is you should be able to target people and tell them what is optometry. It's not optician. It is more than that. Plus, you need to educate them that it is not also ophthalmology because we are lying in between. So there are a lot of bios. So if you tell them that there is a very good perspective, eyes are something which is very common problem. Eye related problems are very common when people, and there's a message, there is a reason why you should become one. You should be. So there are many people I have seen, like I am one of them, who always thought of doing services and helping people over money. As I, one of my director, when I was doing my clinical apprenticeship in Shri Ganpati Netralaya Jalna, which is a small place. It's a semi-rural, semi-urban place. And he asked me, Vishal, why did you come and join optometry? Why couldn't you become an ophthalmologist? Because your father is one. So I said, sir, I wanted to do much more different than what he wanted to do. And he wanted me to be associated with him. So I thought of going through this because this is more community related. And when he asked me, if you have to choose three things in your life, what would you go for in preferential order? Whether you will go for name, whether you go for the fame, or whether you go for both. So I said, sir, if you get do good work, you will get good respectful. Not always following the money. Like I can take the name of our great prime minister who's been belovedly appreciated all over the world. And the reason being that he is doing a selfless work. We may think he's this and that. Anyway, that is apart from that. But what you want to do, what you want to pursue should be your dreams. And if you're doing the right thing for the people, again, for the people and not with financial gains as a primary objective, it will always work in your favor. And the limitations and the difficulties which I feel was to get good teachers, dedicated teachers, and also get good minimum infrastructure, because earlier we never had a statement or a document or a guideline which could tell us that these are the minimum number of rooms you need and things like that. So we use our discretion. We learn from Indian Medical Association Council, that is the medical council which runs the MBBS course, and till 2020, our institute, B.Y. Patil Institute of Optometry, was under the Faculty of Medicine Medical College. So we had very high level of standards. So we used to follow their standards. In not only in having the infrastructure and teaching quality requirements or the minimum qualification credentials required for the teachers, the tutors, the readers, the professors and all, but also as far as the requirements for the minimum classroom, the audio visuals, the ICT, and we call it interactive communication technologies, the latest technologies which are used in your classrooms. So we all followed it, and that helped us a lot. And believe me or not, I don't know, I have a feeling some people say ophthalms do not want us. It's not like that. Ophthalms cannot be without us, and we can certainly not without them. So it's all, both of us are complementary. They just want us to be in our place. Sometimes we cross our limits. We start prescribing things which we are not supposed to do. So that pinches them. And obviously, when you cross your limit, even your parents will get you back. So it's as simple as that. You should know your limits. You stay in your limits, they will always come and help you. So my experience being, not that my father has been there. My father retired about 15 years back. Since then, I'm looking after the college on my own. And I have a very symbiotic and a very fruitful relation, not only with ophthalms, with all the other departments, whether it is medicine, community, whether it is statistics, whether it is psychology, whether we are ophthalm department, which is our. So we have been having a very good relation, and we should know. My only advice or my only observation for so many years is that we should know where we stand and we should never cross that. We should always aim for higher, but not at the cost of others. That is what I think.
Yes, definitely. Dr. Madan, it's really impressive to see how you have excelled in both your clinical and management aspects of life. So, with such diverse educational achievements, in your opinion, how have you excelled those leadership roles and academic pursuits shaped your perspective in the future of optometry?
That's true. That's a good question. So, as you must have seen in my degrees, which I have earned, I guess I've earned, yes, I've worked hard for that. So, the degrees which I've earned, I have done MBA also. So, what I thought about is that Why am I doing MBA? I did M.Com and I still think on doing MBA. The reason being that everybody of us has to be a very good manager. Managing people, managing business, managing monetary intake and outgoing, and also how do you manage your other stakeholders like parents, alumni, the sponsors, the scholarship people, so many other financial providers, finance providers. So all those things we've learned is that managing skills is most important. So we call it MBA, Master of Business Administration, but I would say it is Master of all type of administration, whether it is healthcare administration or anything. So what I've
Yes.
learned over the time is that you cannot be always thinking about only one perspective. You have to think about many multiple modalities which interfere or which come into your mind. So management, I would ask everybody to pursue a PG degree in management. Whether you want to do in human resources management, HR we call it, or you want to do in marketing. Marketing helped me a lot. I have done both. I've done PG DPM from Symbiosis. I've done marketing from Pune University, and it was my passion. Then I found out that I have become a better manager and basically managing my own people. And with that, I have a practice, as you know, I have a clinic with my father, so I'm able to manage that also to understand the basic requirements and other things which you kept quite seen. So I would put very clearly that if you want to be a good, successful optometrist, you should do some sort of a management degree, and it goes a long way to help. Believe me, that is what my take is.
Yes, definitely. Being an MBA in HR myself, I truly believe that. But
Okay,
there
okay.
are some optometrists,
Yeah,
thank you. There are some optometrists who are considering complementing their clinical skills with managerial education. So,
yeah.
being MBA is a vast field. What specialization do you recommend to today's optometrists so that they can get leverages from it?
So there is a lot of new specialization. We call it dual specializations nowadays. So we have healthcare and hospital management. That's a very good kind of upcoming field for optometrists, where you learn not only the health policies of the government, the international health policies, the role of a healthcare provider like us. Also, they help you to set up a clinic, a multimodal clinic, a multi-speciality clinic, a small hospital or big hospital, how to manage. It's basically related to the management of the hospital and healthcare institution. So I would suggest you to go for a healthcare and hospital. It's called HHM, and that will help you not only for your career in optometry because it is interrelated. I know so many optometrists who have done PG, but they love managing nice. Maybe a community-based hospital, and there are a lot of people who are doing very good, and it draws good salary also. And there's a lot of learning curve there, and you tend to interact very well with people around. So my suggestion is dual specialization, healthcare. If you don't want to do that, then you should do HRM, that is human resource management, and you can do with that marketing as well, which I did. Marketing is very important because you should know what is your strong points, whether it is selling spectacles, contact lenses, even vision therapy. You should be able to project 10 points wise, which will help you to make a good impact. So that is what I'm saying.
Yes, definitely.
Mm.
That while
Mm.
reading about you, I came to know your interest areas. So it's in retinal pathologies and diagnostic. So could
Mm.
you please explain to our listeners what diabetic macular
Yeah,
edema is and what is diabetic
yeah,
maculopathy and
yeah.
how they relate to diabetes?
Sure. So what I found out when I was in Mitra that we could do so much by giving classes and contact lenses being an optometrist. What about the things which are happening behind your eye, which are not controlled but managed by medicines and surgeries? So that is the reason why I'm trying to get into to know what is the most common problem in our country. The most common problem in our country is diabetic retinopathy. You know that we are uh, the the world capital of diabetes mellitus. We have the maximum number of diabetes people type 1 and type 2 as far as my knowledge goes, and because of that the related problems to the eye that is related to your retina and your macula is very common. So I thought of doing a PhD on that because my guide was very nice guide, and he was a retina specialist from Shankar Nitrale in DY Patil, say HOD here, and he helped me to guide me to find out the effect of uncontrolled diabetes affecting the retina, which causes DR, that is diabetic retinopathy, and also the involvement of macula. So we found out that about 10% of people in India, about 10% of people lose their eyesight permanently because of uncontrolled or ignorance or casual attitude towards control of diabetes mellitus, which causes diabetic retinopathy. So this was totally reversible, and we also found out that the way to diagnose is very easy by using non-invasive techniques rather than using fundus fluorescent angiography, which was my basic comparison of using HDOCT, spectral domain OCT, versus FFA. FFA is considered to be gold standard for diabetic retinopathy and maculopathy. But then I was able to prove through my thesis, which I submitted and got defended it, that even OCT, HD OCT, and higher forms of optical coherence tomography, we were able to diagnose and monitor the causes of diabetes and even tell the patients that if they control the diabetes now, it is reversible. So the idea was to get an idea how an optometrist can get involved in one of the most common related blindness problems, apart from cataract and refractive errors in our country, and how we can use our knowledge to control it. That was it.
Yes, Dr. Madan. So, as an optometrist, what are the key pointers we should be looking out in patients with diabetes?
So, very good question. What we need to look after is that you should have a smart fundus photography device. As far as I understand, it doesn't cost that much. We have smartphone attachments which can be attached to iPhone, it can be attached to iOS devices, wherein with the mid-dilated pupil, you can take a photograph and you can be the first person or a screener for any diabetic related changes which is seen in diabetes mellitus patient. So you are the first line of defense or identifier of diabetic related problems. So that is the first thing. The first point should be that you should take your history well. You should know how long the person is having diabetes, say 5 years plus. You should 100% take a photograph and keep it for record, or use a normal fundus photographer, or even OCT. Many optometrists I know which are using OCT because they are because it is a side saver, that is for sure. So that is one point. Secondly, if you can have a good referral system or an integrated system with an ophthalmologist, even at your practice, you may be able to offer controlled treatment or a modality which will help that person to not to roam around here and there. Because in cases of diabetes related changes, we first refer to an MD physician or a diabetologist to see whether how good is the blood sugar level or the systemic control of the diabetes. So that is the first thing. So if you have an integrated approach where you have a diabetologist or any other MD physician who's there who can help to give the medication, and then if there are certain early changes, you can reverse it by control of the diabetes, that is the level of glucose in the blood. And if required, you can ask them to consult an ophthalmologist. So my point is that in a good optometry setup, you should have an integrated approach. That is what I have through this.
Yes, definitely.
Yeah.
If we talk about in the patient's perspective, are there any specific symptoms or lifeline factors they should monitor closely in terms of diabetes?
Very true, very true. So the diabetes, as you know, it's very common, and the most common symptom would be the four cardinal signs. That is the polyuria, dyspepsia, that you start having hunger pangs. You start polyuria is that you keep on going to toilet, and then there is constant thirst. So these 3-4 signs are the first signs of person having a higher level of blood sugar level, which is not absorbed because of deficiency of insulin in cases of what we call type 2 diabetes. So both diabetes are obviously, one is insulin dependent, other is not. So the deficiency of insulin can cause type 2, and type 1 is totally, there is a loss of island of Langerhans which are present in pancreas which do not produce insulin. So then they have to go for insulin injections. So coming to the reason why you asked me, the markers or the pointers or the first will be these 3 to 4 signs which a person will have. He will have hunger, he will lose weight, and he will start having thirst. So all these three which happen over a period of 10 to 15 days are the signs of person having borderline diabetes. So you can go for glycated hemoglobin, which we call it HbA1c. So that is it should be less than 5.8 grading point.
Yes.
So if it is less than 5. In India we say 5.65, and in international it is 5.8. So if we have less than that, it is considered to be safe. If it is more than that, then it's a borderline diabetes and has to be monitored. That is the an optometrist can also ask for a lab test regarding HbA1c. That is called glycated hemoglobin. So that should be your duty first, and then if you don't have an OCT, you should refer for an immediate OCT. That is what I would say. Anybody over 5 years of diabetes, whether it is controlled, then 5 years. If it is uncontrolled, immediately after 6 to 1 year, you should go for funduscopy or fundus photography or OCT to analyze any early changes in the retina is there, including the macular area. So that is the first sign. And there are no obvious signs. What we can understand is early diabetic cataract, where the person will get changes in the nucleus part of the cataract, and that person may have a myopic shift. Means the person will have distance vision which may decrease, and the near vision may improve. So that is another thing because of changes in the nuclear part of the lens, human lens. That is the nucleus. Okay, so those are the early signs, but normally we are saying that is seen in early. So as a matter of fact, there are no preemptive signs, but you need to do your checkup with respect to the years of diabetes mellitus and also the history of systemic control. If the person is known to have a very fluctuating or not very compliant with the management which he has been advised to take, then it is quite obvious that you will see certain change. So it is still reversible, as you know. In the young people, say up to 50 or even older, we can reverse it if they have a healthy lifestyle. Then you can reverse it. Otherwise, the next level is to start going for anti-VGF and go for laser photocoagulation and other multivitamin therapies, which will help to make their macula and retina stronger to the oxidation which is taking place, inflammatory changes. So that is what it is.
So, Dr. Madan, apart from these, I would say these symptoms, is there any visual symptoms which should be alarming for the patient and should come immediately in the emergency?
That's a good question. That's a good. As I said, there's a change of eyesight. Secondly, there can be CSR, that is the maculopathy, we call it. There's a fluid on the macula, which is because of the inflammatory changes in and around macula. So that is another thing. He will see that he is probably seeing VV vision. He may also complain of a wheel. Wheel is like a curtain on one side of the eye. So normally from the top portion we see it, or from the lateral portion that is toward your ears, you see a small curtain-like thing which comes, which is not a good news. So these are the visual symptoms which you should be looking for. Change in power, especially the reading power, is the first sign that probably the person has diabetes. And he may, and not only reading, even for distance basic, they will come to tell, I just checked my number and within 2 to 3 weeks or 1 month I am not able to see. Well, that's an alarming sign that the person has got. The thing what you need to ask is, do you have diabetes? And out of 10 out of people which you want to know, 6 will say yes, we have a diabetes, and 99% of those 6 people have uncontrolled diabetes. So first you need to tell them to get their markers, their parameters within normal limits, that the blood sugar level should be as per the normal limits, less than 140, 150. That is your ppm. That is your mgdl, that is milligrams of deciliter in a particular quantity of blood. And that is if they are able to maintain that for about a month, controlled blood sugar level, then you should think about going for any change of number. And of course, that continues increase in sugar level cause diabetic cataract, macular edema. As I said, I have done research on diabetic macular edema. That was the main thing. And those things can be reversed if it is in early stages. If it is not, then the person loses the eyesight. As far as the diabetic maculopathy is concerned, that is what I'm saying. Yeah.
Yes, and now that technology is advancing day by day, and with the emergence of artificial intelligence,
Yeah.
how do you see the future? How can it be
Okay.
utilized for
Yeah.
the early diagnosis and
Correct.
management?
So for the use of AI in machine learning, it is you'll be surprised to know that most successful AI-based modules or technologies which were used in eye care was for identifying the diabetic retinopathy changes. That is grade 1, grade 2, and grade 3. Background and proliferative and the intermediary stage between background and the proliferative stage. So there is a AI is used and there is a grading system. We call it DR, diabetic retinopathy changes grader. So that sort of program is available on many online what do you call courses which are like Coursera. I don't think so Coursera offers. I Hope is there if I have not heard of it. I is small, HOP. I Hope is a nice online platform, a teaching platform for diabetic retinopathy graders. So if you do that grading, I think London School of Hygiene, I think, is LSH is
Yes.
there in your. So they offer also a diabetic retinopathy grading. That not only that, there are other graders also where you can also learn about macular degenerations which are happening due to age related, whether it is wet or dry. Dry is something which can be graded easy. So AI and machine learning is very much in this case because this way you will be able to identify those subjects and accordingly treat them progressively. What I'm saying is aggressively, so that you come to know. So use of smartphone apps, use of Amsler grid in your smartphone apps, the use of color deficiency, contrast. They're all early markers or deficiency in these findings are the early markers of changes in macula. It is also related to early development of cataract. It is also related to optic nerve diseases. The optic nerve diseases, there's a reduced contrast. There's a what you call partial color vision defect. If you have optic neuritis, if you have optic nerve deficiency, which could be related to your diet, which is not proper. So those sort of problems can be easily seen by AI-based apps. And AI is what I have understood is AI is the future. As we know, Chat GPT, Bard, they're all taking over almost everything. Now, don't take it as my personal feeling. Don't take it as a competition from them. They are there to assist you. Like so many things are there to make our things easy. Like for example, we are in a part of a ecosystem where you are sitting somewhere very far and I am sitting and still we are talking so openly and related to our own interests. So this is again machine technologies. So keeping that in mind, AI is a part of our life and we have to absorb it. And as far as the optometry is concerned, it has very good future. You must have heard of Peak, PEEK. So that's also a UK based company which has devised a fundus camera at a very cheap cost, which attaches to your mobile back lens, that is your main lens, and they are able to take the photos, put it into their app, which is in the iOS or Android, and they're able to send live images to the what do you call your ophthalmologist and optometrist, and get immediate referrals as well as treatment modalities. So that sort of app will help us to identify and even manage early causes of disease or deterioration of it. So AI is a friend of yours. Don't take it as a foe. That is what I'm saying. And it has got a good future as far as the eyes is concerned because of eyes visual system and now the optics which are being used in your mobile cameras and your other instruments. So it's just an extension of your eye, isn't it? We are using it. So I will put it like that. Yeah.
So now moving back to your career, you have an years of experience educating optometrists, and you are a professor as well. So
Okay.
with the emergence of these new technologies, and nowadays students are becoming impatient as well, as they
Correct.
are so fond of watching short videos and everything. So
That's right.
how can you think we can innovate studying perspectives and educating the
Yeah,
students? How can we innovate it so that
yeah.
they get more interest learning?
Sure, sure. So basically, when we involve technologies, we call it technology assisted teaching devices. So when we involve technologies, it helps us a lot because we are able to put in a lecture or a video or a clip which is related to the field. For example, I'm teaching about diabetic retinopathy or maculopathy or ARMD, or even teaching how to use low vision aids, or even teaching how to do a pediatric examination, optometry examination. I'm able to introduce a video, photographs, clips which are based on that. So what the person gets is he gets a first-hand feel, not the feel, I will say visual input from what is the instrument, how it is used, and probably that sort of technology helps the person to keep a long-lasting memory as well as understanding to that particular subject. Not only that, you have heard of VTP, that is visual therapies. Now, visual therapies, we used to call patients about 15 years back in our my clinic. I'm just giving you my example, and I used to ask the person to keep his chin on the synecdophore for simple things like convergence insufficiency, for people who are having intermittent divergence script. So we used to call them in the clinic. Now you have a visual therapy based program, which is a computer AI based. I don't think so AI, but it is definitely devised to understand the person on the first level. So that he can do it on his computer screen. He can use his tablet, and he can even use his what do you call the TV screen, where he is given 10 minutes and he's able to simulate his macula. He's able to make his eye muscles and extraocular muscles as well as intrinsic ocular muscle, intrinsic ocular muscle stronger for convergence and other related problems. So as I said, use of interactive communicative technologies, like I said, laptops and use of internet, use of various modules. The students are able to even get degrees, and they get diplomas and certification, which actually helps them to enhance their knowledge. Not only that, and give exams and get certification, which will help them to be a better person in a clinic, in an institution, as an educator. As you said very correctly, that I'm a professor in here, so I am using these technologies. I'm using a tablet, I'm using mobile, and I'm using these platforms to educate. There are so many other interactive platforms which I can be using, which is help us to connect through the ecosystem of the. So we have we have a ERP system which is called the educative ERP system in our institute, where we give the question paper and we ask the student to complete it by weekend and send it back. It's basically an MCQs, but that generates interest. That keeps us connected, and they can also write it back. So Socrates is one of those which is very famous. You must have heard of it. It's a free platform. Then there are other platforms which are used, which can be used for education point of view and also for propagation. The best part about this technologies and the today's world, internet basically, is that you can ask the person in real time. You don't have to wait till next class. And you can send me a query, I can reply back, and I can send you a justification, a paper, a clip, or a movie. So yes, it is much better to be having these technologies, more questions and better convincing reasons. It doesn't.
Yes. Thank you, Dr. Madan, for sharing sharing the light in those perspectives. But if we talk about delivering the lecture and those strategies, so what can we implement in delivering those lectures? If we talk about teaching methodology or pedagogy, what are the elements we can incorporate so that it makes a lecture more interesting?
So what I've seen over a period of time is that we just go with fixed ideas, we have fixed topics, and we have certain topics to cover. So there are two ways of teaching. Either you go and teach them everything, and then they will be initially they will be interested, and after 5-10 minutes they lose interest if it's not of their interest. Second option is to give them the material, let them go. We call it a blended teaching. So it's a hybrid mode where we give them a teaching module, we give them videos, we give them questions, and the students is intrigued. He's been asked to think critically or even deeply, not even superficially about that particular topic, and there's a set of questions here. So we call it an interactive teaching. So this sort of teaching method where we give them a food for thought or a thought for them to think about, and then they come prepared with certain questions which may be related to their life moments also. There are many students who are from a background of optometry, opticals, and even ophthalmologists, and they have seen certain patients and they ask, how do we manage a person who's having less than 3 by 60 vision? So those sort of things is there. We tell them, you tell us what is the kind of clinical conditions you will see. So we make them focus on the main causes, and then related to that cause, say he has ARND, suppose he has RP, he has albino, albinism, or albino retinopathy, or any other retinopathy which can cause the loss of central vision or even peripheral vision. We tell them to think on those lines, and then we tell them that you think about the common ways which you can help them. Say, how would you help them? Would you like to make them a field expander? Would you give them mirrors? Would you give them prisms? Would you give them something which can help them to see clearly from the periphery? So they come with wild ideas. They come with so many ideas, and then we tell them, yes, this is also possible. This is also possible. That. So the idea is to generate that spark. So that spark is only possible if you give them freedom of thought, freedom of thinking. Let it be silly, but we should give them the freedom to ask questions. A lot of students are so afraid of asking questions. They say, what will the sir, madam will say? My friends will laugh at me. I said, that is the best part about it. Interactive sessions should be entertaining, and it should, no matter how silly your questions are there, related to a topic, you should have the guts to ask. And that's what Einstein told. The beauty of asking and learning is that you should ask the same questions. That is how you come to know how intelligent you are.
Yes, definitely. No questions are should be left unanswered, and nobody
Yes.
is making fool of anybody if you
Yes.
will ask question. That is
Yes.
the
Yes.
key point of learning.
That's
I
true.
totally agree with you. So,
Yeah.
thank you. If we move ahead with marketing perspective, how important do you think having those managerial knowledge and marketing knowledge will empower optometrists in the coming scenario?
Yeah. So, as I said before, I think every optometrist should do marketing to some extent. I would say MBA. Again, coming to the MBA part here. So, marketing is important because you should be able to sell your services, your knowledge convincingly. So you should know what to say, when to say, and how to say. Don't be pushy. Be convincing. Give the options. Tell them the reality. Don't make things over and above the reality. As we call it, there's a word called hyperboling. Hyperboling is a word which means that you exaggerate things. That should not be the way. The way should be to tell them the original condition. For example, I'll say you have a NSA metropia, one eye -1, other is -4. So I should be able to tell that person that you are a person who's sitting in front of computers for 10 to 12 hours. That will cause dry eye, but at the same time, to maintain stereopsis, for you to read clearly with both the eyes on a screen, you should be able to maintain grade 3 level of binocular vision, which is stereopsis. For that, a glass will not help you. You will have to switch over to a contact lens. So I should be able to convince in a way where I'm able to tell that person scientifically and physiologically that you will be far better wearing a contact lens as compared to a glass. So I should be able to offer him a try and then ask him the same thing. Now you are wearing these glasses which are equally costly, even more costlier than what you're paying initially for a contact lens when he starts, and then I am able to convince him that, see, binocularly this is more comfortable for your eyes, for your size of the, which is called as anisoconia, that is the size of the image, as well as the size of the object which you are seeing. So if you're wearing contact lenses, there is only variation of 5%, 3 to 5% of difference between two eyes when there's a difference of power more than -3 or +3. So that sort of thing which I'm able to convince it and tell him, then the person becomes your lifetime patient and he understands the need. So again, you're using a knowledge and marketing as well as, and then you can tell them to use a monthly or a quarterly or even daily. So if you do that, that helps a lot. So this is one example where you should be able to, and you should have to set up your, see, in any business, like you are in education is also a kind of a business. Now let us accept it is not free for all. So you need to set up your goals, your objectives. So that is what marketing teaches us. That this is level one, level two, level three. I have to reach level one, level two. I have to call people. I have to remind of them for the appointments, which may be important for your marketing, your income, but also for their health. So those levels, you should have a performer ready with you. Call, remind, give them incentives or some sort of marketing offers. So there's nothing wrong with that. Even you contact them personally, it's, but as far as the ethics are concerned, you cannot advertise because the medical ethics for the doctors, which is applicable for us also, is that you should be able to advertise only for few reasons. That is when you're shifting your clinic or you're offering something. But you cannot say that I'm offering something which is purely on the basis of your imagination that you're only offering. That is not the way you're supposed to. Your name, your efforts, your quality, and your expertise can only be known by the work, and that work can be only advertised by your word of mouth. If I do good work, my efforts, my treatment, my management, my sincerity, whatever word you want to say, should go into person's mind, and that person should be able to tell 10 more people that this is. So word of mouth is the way to advertise and market. But there are certain things where people do it, and sometimes you should do the marketing, as you said, online marketing through Facebook. I think that is what we are doing. We are in an integrated world. We cannot be Facebook, Twitter, and all. That is a part of it. But the only things you should be sure about is give the authentic information. Don't give any false information, because that is then you are liable for prosecution. That is very
Yes,
important.
definitely.
Yeah.
Having said that, nowadays when bachelor students are graduating from optometry, they are quite confused whether
Hmm.
they have to go for clinical setup or they want to pursue master's degree or management degree or they
Hmm.
want to go for a PhD.
Hmm.
I think they are really confused. So, what are your views guiding those
I,
students?
very, very good question. I was waiting for that question actually, because that is the most important thing which I have seen. And not only students, the parents are more confused because they don't want the children to go away from their homes. So it's quite
Yeah.
possible that your parent also didn't want it that Sucheta should go all the way to wherever she's gone and do. So those sort of attachments are there which every parent will have, especially countries like ours. So the reason why I'm highlighting this is that there is no substitute to education. So education gives you knowledge, and knowledge is by far the biggest power you can have. Nobody
Yeah.
can steal your thoughts, your knowledge, your expertise, which are there in your grey matter. That is your mind. Am I right? So till now, there is no machine which can extract it unknowingly in your unconscious mind. You're sleeping and somebody puts a machine and he extracts your brilliant ideas, your PhD topics, your research, which is only known to you. So this is the biggest depository of your knowledge, wealth. I will put knowledge is wealth. So getting that first is the most important thing. Second thing is after you do that, then you'll get a clarity in your life. That's what you want to do. After you get educated, you do your like you're doing PhD, you will get a much better clarity that you're what is more important. I'm talking about anybody, not you in others. In general, I'm talking that person will get an idea whether he wants to do business. If he wants to do business, he'll do bachelor's and do MBA. That is what my suggestion is. That he should expand his. If he wants to be in diagnostics, still he has to get a PG. Still better to PhD because you will be finding out some new methodologies to help people in general, whether they are poor or general people. And also, if a person is want to do only teaching, there are many students of mine who want to do only teaching. They find teaching the best way to get connected to their profession. There are many students who leave they just complete their bachelor's and they just go into setting up a chain of optical dispensing stores or clinics for that matter. And there are many people who there is no end to education. They keep on studying. I'm one of those. I did one PhD, now I'm doing a second PhD at my MBA because I want to integrate my knowledge for the some better instrumentation which will help the society. So it's all. But again, if you ask me, over these many years which I've done, I have a clinic. That means I'm earning money. Also, I am teaching also, and I'm also a teacher and I'm a researcher as well because I'm doing PhD and I'm also an entrepreneur. So keeping all that in mind, the most satisfying thing for me is education, knowledge. It gives you a lot of happiness and peace in life. So I would put that, and I give you opportunities to interact people like you and share my knowledge all over India and abroad. So it is nothing. There's nothing can compare your knowledge. That is your education. So my first priority to all the students around here is achieve what you want to do. Do the best in your profession. Automatically you'll get jobs. Automatically you'll get offers, and automatically start. They will just follow. You don't have to go after them.
Yes, definitely. When I was graduating, I was so confused. I did MBA, then again I did masters, then I wanted to learn more. So learning never stops. That's why
So,
we
so
all are
you are
here.
agreeing to what I said. So you have actually given that feel that once you enter
Yes.
into this, there is no end to it, and you feel good about it. But you should give
Yes.
it back to the society. That is what I want you and me to follow. We have to give it back also with
Yes,
interest.
definitely.
Hmm.
Bilkul. Thank you so much, Dr. Madan, for such a interesting conversation and sharing your valuable insight with us.
Thank you.
And that's bring us to the end of this episode with you.
Sure.
Uh, Thank you so much for sharing your insights and your wealth of knowledge and experience with us.
It was my pleasure being with you people. And anytime you need any help, please connect my email ID to anybody. I'll be more than happy to.
Please follow Dr. Madan to know more about his exciting journey. I also want to extend my thanks to our listeners for joining us today on this episode of InSight Radio. We hope you found this conversation enlightening and informative. Remember, the journey of understanding and exploring the world of optometry never ends. So stay curious, stay informed, and continue to seek knowledge to make a positive impact in the lives of those affected by diabetes or any kind of pathologies. I'm Sucheta Mitra, your host, and it has been a privilege to guide you through this enlightening conversation. Be sure to tune in next time, as InSight Radio is committed to bring you thought-provoking discussions with leading experts in the field. Until then, keep your eyes open and your curiosities alive. This is
Thank you.
InSight Radio, where we envision future of vision science one voice at a time.
Thank you so much.
Thank you so much, sir, for accepting our
You're
invitation.
welcome. In the end, I would like to say that we are always students and we are always learning. So learning never ends, and you should always be humble and down to earth to learn properly. As Swami Vivekananda said, that to learn, you have to be down to earth, and you should learn to be barefoot and walk and feel the problems and the troubles and the efforts taken by even smallest, poorest person. So when you gain that sort of knowledge, experience, you go very high, and you never forget where you stand. So that's it. Thank you so much.
Thank you so much, sir.
Thank you.
Thank you for watching. If you found this episode valuable, be sure to subscribe to our podcast on your favorite platform. Never miss an episode.
InSight Radio. One vision, many voices.